As she said, my name is Angela Roberts. I've been in the position of 988 Program Administrator for a year and have had the pleasure, privilege of working with all of our community mental health centers, including Darcy and her team at New Vista. So this is how Kentucky is structured. We do have 14 community mental health centers, but of those, we have 12 primary centers that cover all 120 counties. So the ones that are shaded green are the ones that for which we have 988 centers located within the community mental health centers. The ones that are green and white striped are centers that have coordinated with another center to take on their calls. So again, all 120 counties are covered. Next slide. Where we're working to build capacity is that we're at about 88% coverage for backup of all of our counties. So pretty much everything in blue is covered by a backup center in Western Kentucky, which is Pennyroyal. And we're continuing to build capacity for the other 6 counties outside of Pennyroyal's area by working with our community mental health centers to build that so that we can ensure that, as Darcy was saying, that the calls are routed by area code and prefix, that they stay in Kentucky. And our goal is to ultimately get to 90% answer rate with that. So we're continuing to build this capacity as we're now 7 months post launch of 988. So continuing to do the work. So this just kind of shows you a trend of how our call volume has evolved over time. Pre-launch of 988 in July, you can see we averaged just under 2,000 calls a month. But once 988 launched, we have seen a steady increase in our call volume, which was predicted prior to going live with that. So we've been working with the centers to build capacity to make sure that Kentuckians in crisis are able to talk to someone in Kentucky who understands the cultural, the geographic, and just the general dynamic difference of Kentucky as it is. So since we went live with 988, we've been seeing about a 500 call increase each month, and we're expecting that to continue. And we haven't at this point done a huge marketing push on it because we want to make sure that we have the capacity to answer that. Because if a call is not answered at the primary center, then it will roll over to the backup center for Kentucky. And generally, that's where it's answered. So we're doing that at about a 76% answer rate at the moment. But if it's not available to be answered by the primary or the backup in Kentucky, it does roll to one of the national backup centers. So there's always that the opportunity for a trained crisis counselor to assist someone and help them through that crisis. Next slide, please. Where we saw the significant increases in the chat and text once 988 went live. And you can see, particularly with the text component, when 988 launched in July, it became where you could text to 988 as opposed to a 5-digit number. So we know that the majority of those using text are our youth, and they tend to do it in the evening. So we currently have one center that is taking chat and text for Kentucky on a Monday through Friday basis for 3 hours at a time. And again, this is something we're working to build capacity so that someone in Kentucky experiencing a crisis that needs to chat or text with someone can do that with someone from Kentucky. And we're continuing to evolve that, but focusing on the primary thing and making sure that the calls are being answered since that's where the greatest demand occurs.